Tactical Blue TV, the place where badass sheepdogs read, listen, and watch unique leaders who teach the science of law enforcement, tactics, and practical skills to coach the American cop. If you're a badass, this is your new home. Now, the man who catches speeders during his lunch hour, Hector Solis.
Welcome back to Tactical Blue. This is your host, Hector Solis. I'm glad that you are back. And today we're going to talk about a topic that everybody's talking about, but not everybody's giving you the proper guidelines, specifically for law enforcement professionals. A law enforcement guide to COVID-19, Part 1. Tactical Blue provides the following information to facilitate the planning for and execution of civilian interaction between law enforcement personnel and members of the public. Information presented is in chronological format and provided at a level of detail that affords police officers and law enforcement supervisors the flexibility to develop procedures that are suitable for their environment. Now, first, what is COVID-19, also known as coronavirus? Coronavirus disease 2019 is a respiratory disease caused by the SARS-CoV-2 virus. It is spread from China to many other countries around the world, including United States. The Occupational Safety and Health Administration, OSHA, developed COVID-19 planning guidance based on traditional infection prevention and industrial hygiene practices. It focuses on the need for employers to implement engineering, administrative, and work practices, controls, and personal protective equipment, also known as PPE, as well as consideration for doing so. The U.S. Department of Health and Human Services Centers for Disease Control and Prevention provides the latest information about COVID-19 and the global outbreak. If you go to my website, www.tacticalbluetv.com, you're going to find a blog to this podcast where you can find the links to each guideline from OSHA and the CDC. Now, what are the symptoms for law enforcement officers and some that you need to look for in other people? Infection with SARS-CoV-2, the virus that causes COVID-19, can cause illnesses ranging from mild to severe, and in some cases can be fatal. Symptoms typically include fever, cough, and shortness of breath. Some people infected with the virus have reported experiencing other non-respiratory symptoms. Other people, referred as to asymptomatic cases, have experienced no symptoms at all. So how is COVID-19 spreading? Police officers, emergency medical services, and corrections officers are categorized to be in the medium risk category. The virus is thought to spread mainly from person to person, including between people who are in close proximity with each other. The range is 6 feet. Contamination from respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly inhale into the lungs. It can be transferred by touching a surface or object that has SARS-CoV-2 on and then touching your nose, mouth, or eyes. A person could be most contagious when they are most symptomatic, when they have a fever, they're coughing, or shortness of breath. Criminal justice professionals should avoid contact with people who are not aggressive or a danger to others. However, some spread might be possible before people show symptoms. Some reports indicate asymptomatic transmission with this new coronavirus. But this is also not thought to be the primary way the virus spreads. Now, there are some times when hands-on is unavoidable. At some point, you'll have to go hands-on either to arrest a person, handcuff them, or even wrestle them to compliance. The CDC encourages police officers and corrections officers to follow the guidelines of ambulance transport. These guidelines ask to avoid direct contact with people who could be infected. Nevertheless, how do you know who is infected and who is not? You could be carrying the virus at this moment without even you knowing. These preventive measures can help stop the spread among police officers and inmates at your law enforcement agencies. If you become sick, and you have any symptoms, fever, cough, or shortness of breath, get cleared by a doctor before going back to work. Remain home with a fever of 100 degrees or higher until fever is below 100 degrees without the use of Tylenol, ibuprofen, or aspirin. Then you can go back to work. Wash your hands and hand sanitize them regularly throughout the day. Do not touch your face, nose, or eyes. Avoid hand-to-hand contact with others. Clean the surfaces, materials, and other tools with disinfectant wipes before and after use. This includes keyboards, computers, printers, or any other desk or area that you usually use. Now, what is the difference between cleaning, sanitizing, and disinfecting? The majority of people who are attempting to stop the spread of germs and COVID-19 use the cleaning and disinfecting wipes. This solution is excellent, but it doesn't help stop the spread of the germs. Now let's explore what cleaning, sanitizing, and disinfecting is and how to do it properly. First, cleaning refers to the removing of germs, dirt, dust, and other stains from hard surfaces. For example, in our police department, the chief of police asked us 2-3 months ago to clean all the mobile data terminals, MDC, aka laptops, our workstation, and the department floors. Cleaning won't stop the spread of viruses, but it maintains a clean environment where germs won't thrive. In the past, occasionally, we use wipes and sprays to sanitize any object we touch inside the patrol vehicle or stained by blood or other human bodily fluids. Wiping these surfaces sanitizes the area, meaning they lowers the number of germs on the surface. If you look under the microscope, these surfaces still have several germs left behind. Finally, to avoid the complete spread of COVID-19, you must disinfect surfaces before usage. Disinfecting means leaving the disinfectant on the surface for approximately 3 to 5 minutes. Remember, spray, wait, and wipe. Furthermore, clean the surfaces, then disinfect them. You can clean the surfaces at the end of your shift and leave the solution until the next day. Then, the next time you use them, you have to wipe the germs away. So there are different risk levels to contract COVID-19. Some of these levels apply to law enforcement professionals. In my blog at tacticalbluetv.com, you can see the chart that shows you which jobs are at risk of contamination from COVID-19. I recommend discussing this information with your supervisors and assessing the situation accordingly, depending on the population, exposure risk in your police departments or correctional facilities. Now, we have the very high exposure risk jobs. Those are with high potential of exposure to known or suspected sources of COVID-19. Those include medical, postmortem, or lab procedures. Workers in this category include healthcare workers, laboratory personnel collecting handling bodily fluids, morgue workers, those generally performing autopsies, health care delivery and support staff, medical transport workers, and mortuary workers. Law enforcement professionals and correctional officers fall under the medium exposure risk. Although some people might say that we're part of the high-risk population, we can control some of the personal interaction between us and the public. Medium exposure risk jobs include those that require frequent or close contact with people who might be infected but not know, within 6 feet of the person. Also, they can have contact with the general public, for example, at schools, high population density work environments, and some high-volume retail settings. Now, there are also the lower exposure risk. Some people who work from home and non-interactive jobs fall under this category. Farmers, stay-home mothers and workers, and other similar jobs are at low risk. Despite that, these people should continue following the guidelines to avoid the spread of the virus. Workers in this category have minimal occupational contact with the public and other coworkers. If you want to know more about COVID-19, stay tuned. This is only part 1 of the 2 article series and podcasts for COVID-19. In the next podcast, I'm going to talk about self-monitoring of the coronavirus if you happen to have it. Also, I'm going to include some mandatory standard operational procedures I implemented in our police department, and you could implement those in your police department or law enforcement agency. and the personal protection equipment rules that we are using. And some of those PPEs are not found right now in certain stores, but I was able to talk to Officer Jason Payne, which is a OSHA certified trainer, and he guided me to specific places like, for example, Home Depot or Lowe's, where I was able to find different items that combined makes a PPE. So I'm going to talk about that in the next podcast. So stay tuned and don't go away. This information could save your life, literally. Stay safe and watch your six.
Thank you for joining us on another episode of Tactical Blue. If you know other sheepdogs, share this episode.